and anywhere from 2 to 6 units. Now you definitely don't want to put too much because that can affect your smile in some ways, but if you control the amount of Botox you use, you can avoid different things. And I never had a problem with putting Botox in to treat the bunny lines. And some people don't like lip lines. As you age, you lose volume around your mouth, and the constant contraction of your mouth for eating and whistling and so forth create these vertical radiating lines. And you can put Botox around the mouth in 2 to 8 shots, ranging from 2 to 8 units, and you can prevent that muscle that encircles the mouth from contracting and creating those vertical lines in your mouth. And you can also use, a lot of people don't like wide jaws, and it's really common in my Asian population, and I put a lot of Botox for Asian people on the jaw area, and I use anywhere from 20 to 40 units on each side of the jaw to prevent that muscle from protruding. After the Botox eventually weakens and that muscle gets smaller and smaller, and over time as you use it more, that jaw muscle gets weaker and weaker and smaller, and it lasts longer. And typically Botox in the jaw area typically lasts longer than other areas. And in terms, some people don't like downturned mouths, and this is another way to elevate the corners of your mouth by putting Botox in this muscle that pulls down the corner of your mouth. And you can use anywhere from 2 to 5 to more units, but you have to start slow in this area because you don't want to put too much, because it can affect the way your mouth works and in terms of eating and so forth. So I usually use 2.5 to 5 units on each side of the for the corners of the mouth. Now some people don't like dimpling in the chin, and you can also use 5 to 10 units very close to midline to prevent that chin muscle from balling up, which a lot of people don't like. And that's another option too, that you can use Botox. Now the other area that people use Botox is in the neck muscles. Now a lot of people don't like that neck banding, and you can use Botox in that area too to prevent your muscle, this platysmal muscle that goes from the bottom of your neck into your jaw and contracts and creates that stringing in your neck. You can put Botox in 2 to 12 injections on each side, and you can use 10 to 100 units, and usually people use more units when they try to affect the neck muscle from contracting, and that essentially prevents that muscle from contracting, prevents it from banding up, and a lot of people like the way that works. Now these are just some examples of people, my patients who had Botox. This patient really didn't like her muscle balling up here and creating those vertical lines and making her look angry. So Botox really helped her appearance in this area. And as you can tell the difference, this is on maximal contraction. She can't contract that muscle and create those vertical lines, and it really makes a difference. It can also help many people with headaches too, caused by that contraction. Now this is an example in Botox in the forehead where I did 4 shots of 8 units. She only had 8 units, and it did a great job relaxing the forehead muscle, so she wasn't able to create those wrinkles in her forehead. Now this is in contraction. She doesn't normally look like this where her eyebrows are arched. This is when she's really working, and you can make this arch different shapes, and for her she could have used some on the side if she wanted, but she liked that. And that was contraction. Now this is at rest. So at rest, again, as I was trying to mention earlier, her eyebrows didn't look arched. That was only when she really pulled up her eyebrows. And as you can tell, at rest she looks great. Her wrinkles in her forehead are markedly improved, and her crow's feet are better as well. And then this area in between her eyes is markedly more relaxed. This is another picture of one of my patients who benefited from a Botox in the crow's feet area. As you can tell through contraction, she's not able to contract that muscle, and it markedly has improved these wrinkling in this area. So Botox is a great way to maintain your appearance by making certain muscles in your face weaker so that it doesn't create dynamic wrinkles. Now over time it's been shown that if you use Botox, those dynamic wrinkles and Botox eventually affects the static portion of the wrinkles, but that has to be done over time and repeated uses of Botox. Now Botox again lasts anywhere from 3 to 6 months, and typically when you first start using Botox it's going to last around the 3 to 4 month range, and it really depends how much Botox you use, because the more Botox you use, the effect lasts longer. But as you use Botox more on a continual basis, you will notice that the Botox will gradually last longer. So again, that's my discussion on Botox, and you can call me or email me if you have any questions on it, and I would love to help you. Thank you.